Welcome from Geneva, Switzerland. I'm Reda Sadki from the Geneva Learning Foundation. I'm here with Charlotte Mbou, who is in Ibolova, Cameroon, and Maria Monzon in Corrientes, Argentina. We're about to get started. This is a global conversation, part of a series of lightning chats on the overall topic of climate and health ahead of Teach to Reach 10, for which there are over 21,000 health workers registered to participate. Over 900 have already contributed insights, experiences, and you'll be hearing some of them who are our guests of honor in conversation with Maria Neira, our guest, who leads climate change and health at the World Health Organization. So that's what we've got coming up. We're also 6 days away for the English language Teach to Reach. In the 25 seconds remaining, I want to ask Charlotte how she's feeling about that.
Very, very excited, Reda, as we count down to Teach to Reach 10, and the energy is on the rise, and we can feel it even among the members of the Teach to Reach community.
All right, wonderful. Okay, here we go then. Warm welcome to you from Geneva, Switzerland. I'm Reda Sadki from the Geneva Learning Foundation. We're kicking off today what we call a lightning chat. This is a rapid fire conversation. Today, our guest is Maria Neira. She leads climate change and health at the World Health Organization. We are not going to ask her for a formal introduction because we are going to dive right into the topic. Last July, the Geneva Learning Foundation called its global network of health workers. Within 10 days, 4,700 health professionals had registered to share their experiences around climate change and health. We asked you this question: is climate change a threat to the health of those you serve? Why? Of those who answered within a very short time, most of you say that you are part of the family, for the community that you serve, or a trusted friend. And the answer you gave us scared us. You said most of you consider climate change to be a threat to the health of the community that you serve, and most of you, again, worry about climate change. This has led us to put climate change and health at the top of the agenda of Teach to Reach 10. In case this is the first time you're hearing about Teach to Reach 10, I invite you to go and request your invitation. Search for Teach to Reach with the Geneva Learning Foundation. And we're pleased to share also that we've just announced the final schedule. You can consult on the Teach to Reach event website. You'll see our global and local partners, as well as the full content of the program. So we're going to dive right in with the first question. I'm going to turn to Charlotte to ask the first question to Maria Neira. Charlotte, over to you.
Thank you, Reda. Maria, the recent World Health Assembly resolution on climate change and health has been hailed as a landmark commitment. From your perspective as the WHO Director for Climate and Health, what are the most significant aspects of this resolution, and how do you see it shaping the global response to this crisis?
Thank you, Charlotte, and thank you, Reda. It's such a pleasure to be with such an audience, and knowing that so many people is connecting gives me an enormous responsibility. Why the global resolution on climate change and health is a landmark? First, because the ministers of health who were here in Geneva, together with the global health community, because it's not just the ministers of health, it's the global health community, they first put the evidence on the table, saying, yes, climate change is affecting our health. Yes, there is a role for us as the responsible for health to do something to convince our governments of doing two things. One, reduce emissions, mitigate the causes of climate change. A second, prepare our health systems to cope with this massive threat that is representing climate change for our global health and our communities. We need as well to reduce our own carbon footprint. We need to make sure that we respond to the crisis that people are already facing, and we need to use our voice, the power of the voice of health, to convince governments to do three things: accelerate the transition to clean sources of energy to stop this disaster. Second, to accelerate the transition to sustainable food systems with what these represent. and third, accelerate the transition to better planning at the urban level of what our cities are for the people that will be living in urban areas, which now represent more than, in a few years, will be more than 70% of the global population. So a big excitement, energy, and then taking the flag very strongly, the health argument to convince people to do more about climate change.
Thank you, Maria. So many health workers in the Geneva Learning Foundation's Teach to Reach network, this network that reaches altogether over 50,000 health workers. Over 21,000 of them have registered for Teach to Reach. They've shared heartbreaking stories of climate-related suffering that they are eyewitnesses to in the communities they serve. So, for example, Iroma Chinedu Ofortube from Nigeria recounted the tragic loss of a pregnant woman in labor when a flood struck. And she's convinced that this flood wouldn't have happened had there not been changes in climate over the long term. So as you are leading the efforts at the global level for the World Health Organization on these issues, what is your message to health workers such as Iroma, and what do you want to convey to them as they grapple already with the impacts of climate change on health that are being discussed at the global level?
That is true. I mean, every single health worker around the world is already feeling what climate change represents for people's health, whether they are exposed to extreme weather events and therefore flooding, or all these natural disasters that the world is facing now. You take a newspaper, you will see in the headlines one of those extreme weather events, and of course, this is affecting our health. Second, if you have an extreme weather event, people might migrate. There will be massive displacements. There will be, of course, if there is a flooding, maybe we will lose our capacity to have agricultural production. Then we will have the mental health issues associated with that. And then, of course, this global warming will be representing better conditions for vector-borne diseases or waterborne diseases to spread. Of course, the quality of the air we breathe. So what's the role of the health workers? They need to be prepared. They need to take opportunities like this one to learn, because I'm afraid we will be facing more and more frequency and intensity of those extreme weather events. They need to be better prepared at the healthcare facility to cope with all of those diseases that are associated with climate change. They need to use their voice as well to talk to the politicians, whether it's a municipal level or local level or government level. They need to mobilize the health community to say we need to stop this nonsense of keeping with the wrong practices that are causing the climate change. And they need to collaborate with others and intensify vector-borne control, epidemiological surveillance. If they can as well, they need to connect with other networks that the one we have here today to together be stronger on all the advocacy and the impact we want to have together.
Wonderful, thank you. I'm going to turn now to Maria Monzon, our partnerships coordinator for Teach to Reach, calling in from Corrientes, Argentina, for the third question, and then we're going to open up to hear from Teach to Reach guests of honor who we've invited to join us in our Zoom studio today. We're also looking at your questions and comments coming in from social media, from YouTube, Facebook, LinkedIn, Twitter, wherever you may be. Please do share. Don't just say hello. Do share your questions and comments. Maria, over to you for question number 3.
Thank you very much, Rita. Good morning, Maria. Let me go ahead. So as Rita was telling you, Teach to Reach is a unique platform. So we bring together over 20,000 health workers from more than 80 countries to share experiences, to learn from each other, and to co-create solutions. So my question is, how can global partners leverage such networks to ensure that the implementation of the World Health Assembly resolution is informed by the knowledge and priorities of those on the front lines?
Hola, Maria. Muchas gracias. Yes, stronger if we are together, definitely. We have a network of relevant societies, professional societies, NGOs, activist groups, and of course, government representatives to make sure that the health argument at COP, for instance, when we will go to Baku, at the end of the year to represent the health argument, nobody will be able to say there is not a strong or enough scientific evidence. That's out of question. We have now very solid and very consistent scientific evidence telling us that climate change is affecting our health. I will invite any of your participants to have a look at what is called the National Determined Contribution, NDCs. Each country should have a plan, a national plan on how to deal with climate change. Have a look at that. You will see that health is maybe mentioned, but then there is not properly represented. So use your channels as well to make sure that you do advocacy about better inclusion of the health consequences of climate change in all the national plans. Join other groups. You are very much welcome to join us on our network to make sure that we elevate our voice. We need to use our international and global capacity to raise funds for climate change and health on the adaptation, loss and damage. We need to make sure that we are part of the decisions at the COP, making sure that the reduction of the emissions is taking place and they're transitioning away from the combustion of fossil fuels, because this is the only way to stop the causes and then start to reduce the causes of climate change, the mitigate climate change. But then the WHO resolution will help us as the global health community to advance, to create together this global plan of action. I invite you to be part of, as the civil society as well, of this definition of the global plan of action, and hopefully our voice will be very, very strong. Nobody will be able to say, this is not your role. Climate change is for the environmental ministers or the governments or the ministers of energy or others. No, it's a question of health as well, and we are the ones suffering at the front line of the consequences of climate change in the health of our communities.
Right, thank you very much indeed. Let's go now to Charlotte, who's going to tell us who we're going to hear first from. For those of you who are in our Zoom studio, we do have some questions coming in via the live stream, so we'll be getting to those in a minute. Charlotte, who shall we hear from first?
Okay, Reda, thank you. I'm inviting Mario C. And as you unmute yourself, please, you introduce yourself, tell us who you are, where you work, and then ask your question to Maria.
And Marius, you'll need to, you're not using headphones, unfortunately, so we are hearing the background noise and the feedback, so please go ahead now. But you'll need to lower your volume to speak to us.
Can you hear me better now?
Yes.
You'll need to lower your volume to speak to us. Okay. Yes. Is it better? Am I heard clearly?
Yes, go ahead, Marius.
Yes, please.
Probably I'm not. Yes, go ahead, Marius. Okay. I'm Mario Hatzidamnianos. I'm established in Greece. I represent an organization doing cultural self-identification, and my question has to do with the fact how we prepare the global North to prepare themselves for the huge populations on the move and the democratic shift taking place across the globe in terms of enabling the doctors existing in those nations to comprehend and fight against disease that will be moving along with this population. Thank you.
All right.
Marius, this is a question that it goes beyond climate change. That's something that we need to make sure that we use the health workforce where it's needed, and when the conditions are created, they can change the country. Regarding I suppose you are talking about how the displacement of the population can bring maybe infectious diseases or new. I think we need to create the conditions in the countries for people being protected. And that's why when we talk about climate change and health, we need to make sure that the priority is to mitigate, to stop, to close the tap, the tap responsible for the causes of climate change. Every government should have a look at the sources of energy they are using. And on that, the voice of the health community can be very strong. You need to use your knowledge, and every health worker should be empowered to understand why the combustion of fossil fuels is a health matter. And it's simply because the combustion of the fossil fuels will not only be responsible for global warming, will be responsible as well for air pollution. And air pollution is responsible for many respiratory diseases, for many chronic diseases, cardiovascular diseases, stroke, and now we have even evidence that it's affecting our brain. So we need to make sure that everybody understands that if we tackle the causes of climate change, if we reduce, one of the most immediate benefits for health will be the reduction of air pollution, which is at the moment responsible for more than 7 million premature deaths every year. I repeat, 7 million premature deaths every year caused by exposure to toxic air that we are breathing all around the planet, not only in very poor countries or low-income countries or middle-income countries, everywhere. Air pollution represents a huge problem for our health, and therefore our voice on the transition to cleaner, sustainable sources of energy should be so important. It's like having access to clean water. For us, for the health community, is fundamental. But having access to clean sources of energy is fundamental as well for the public health global community.
Thank you, Maria. We're now going to look at a question from Moses Barima Jumate, and going to go to him. He's with us in our Zoom studio. He's one of our guests of honor this today. He's a public health physician working with the Ghana Health Service, Deputy Director of Public Health in the Northeast region of Ghana. He says he does a lot of work on rabies control using the One Health approach, and he's seen tremendous results since choosing this. Dr. Moses, we're going to ask you to relate this back to climate and health and to explain what is specifically your question for Maria Neira from WHO. But first of all, welcome, and do introduce yourself.
Yes, thank you very much. I think you've done the introduction. So I have been involved in the rabies control in Ghana for the past 7 years using the One Health. What I have not considered for the most period of
Dr. Moses, I'm afraid you are fading in and out.
It's the impact of to reach was. Well, it might be maybe the internet. Okay, let me see how it goes. Yes, so I've been working in rabies. I have not really give consideration to the impact of global climate change, but my invitation to the T2Reach said me thinking about it. The Agenda 2030 for the of canine-mediated human rabies is limited to canine rabies because the idea is that over 99% of human rabies is transmitted by dog bites. Now, with climate change, if something we have not thought about happens, and then with the movement of animals, we get, for instance, more interactions between the mammals in the wild, who are also sources of rabies, then after the 2030, assuming we are able to achieve the dog, the canine mediated, then we have the risk of increasing the disease again because of climate change effect on animal movement. So using the One Health approach, we are seeing results. What I want to ask Dr. Maria is this: why is it that at the global level, we know the impact of One Health in the interventions for both NTDs and other disease? Why is it that at the global level, we don't see much of this collaboration? Everybody is working in silos. Then when we get to the lower levels, we want to work. So the big decisions are being taken without recognition for One Health approach. But then at the lower level, we want to use One Health. How can we change the approach? How can we change the approach? Thank you.
Moises, I cannot agree more with you. I think you are using this One Health approach, which is nothing else than common sense public health approach. We can do it for climate change, but we can do it for diseases. We can do it to solve most of the issues we have on preventing future pandemics, because more we work on One Health and respecting the environmental barrier, more we will be preventing as well the emergence of potential zoonotic diseases and breaking the barriers that we normally have between human health and animal health. So environmental health is critical. And it's going back to the basics, as you rightly say. More and more now, if we want to fight and protect our population from the consequences of climate change, which will be diseases like dengue, malaria, and neglected tropical diseases, more and more we need to put in place the One Health approach and the nature-based solutions, which are the ones that told us for many years in public health that if we want to do vector control, we need to look as well at removing stagnant water, because otherwise the mosquitoes will grow there. Or we have little fishes in certain places that will eat the larvae of certain mosquitoes. Or making sure that in the places where we live in our communities, now more and more the health workers, we will have the responsibility to teach our communities to protect the environment, the ecosystems. More we destroy the environment or we change the ecosystems, more we will have the probabilities of breaking that barrier between animal health and human health. So I fully agree with you. Whether it's for controlling rabies or for controlling any of neglected tropical diseases or any of the diseases, even watery, diarrhea, cholera, we need to make sure that we start everything with environmental health. So protecting access to safe water, making sure that we have vector control activities with nature-based solutions. We have clean our environment and our ecosystems, and we stop the destruction or the desertification or the deforestation that might have major consequences on the ecosystems, and therefore we lose the fantastic green barrier for our health that is created under the One Health approach. So yes, I agree with you that at global level we should do even more. Now it's gaining a lot of space, the One Health approach, but it depends on all of us to implement it at every single level, local, community, regional, and global. Thank you.
Thanks, Maria. One more question for Dr. Moses. So you've had a response from Maria Neira at WHO. What, at this stage, you in your region have made these observations, have reflected on the impact of climate change on health and specifically rabies? What would be most helpful to you from WHO, from the World Health Organization? What kind of support, what kind of guidance would actually be helpful to you in terms of the challenges that you are facing today, Dr. Moses?
Well, if in terms of specific challenges we are facing, we know that as per the most recent guidelines for post-exposure prophylaxis, for instance, the idea is that the intradermal administration of vaccine is a vaccine saving, is vaccine sparing, it is cheaper. Unfortunately, what we have now is the intramuscular, and which follows the five dose regime over a period of 3 weeks. Aside the consumption of vaccines, it also happens for a long period, and adherence might be difficult. So for me, if it is specific about our control, how to get, recently I've been looking for the 0.1 syringes for the delivery of vaccines intradermally. We don't have it. So still, yeah.
So you're dealing with very specific technical considerations, not necessarily thinking about the impacts of climate change on the health, even though you have been able to look at those as well. Thank you. Thank you very much indeed. We've had some great comments that we've been sharing coming in from social media. Next, I'd like to, and I think this may be the last question for this lightning chat. If you're going to be left thirsting for more, that is exactly what we're hoping, because we are now 6 days away from from Teach to Reach 10. And we encourage you to, if you haven't already, request your invitation, join. We'll be doing more listening and learning. Now, listening and learning from people on the ground is messier than the very clean, in a way sanitized discussions that can happen at the global level. But we believe that it's by putting our ears to the ground that we can indeed understand many of these important issues. Elsie Kishoin, you're calling in from Ghana. You're with us here in the Zoom studio. You said, I do a lot of work that majorly deals with community engagement. One approach that I've used and seems to work is community-led approach. The communities come up with solutions to the problem they're facing. This approach is affordable and sustainable, and it gives the communities a sense of ownership. Elsie, what is then your question for Maria Neira specifically on climate and change? We'd love to hear from you. I'm asking you to unmute, but so far you have not been responding. So I'm going to turn to Maria. We're keeping an eye if you unmute your microphone. Okay, here we go. Elsie, please do introduce yourself. Tell us exactly what you do in Uganda and where in Uganda you are doing this work with communities.
At this opportunity, I do this work majorly from the eastern part of Uganda, that's Karamoja. And we have so many issues when it comes to climate change, drought, and when it rains. And we sat and said, what can we do to curb this killing people?
All right. All right, Elsie, I'm very sorry. Unfortunately, this happens to This happens to everyone, unfortunately, and I'm very sorry we're not going to get to hear your voice, but I believe your question is clear. So turning to Maria Neira, the role of communities at the Geneva Learning Foundation, we're particularly concerned that if there is large investments in improving policy and science, that is great and very much needed, but if there is not a commensurate investment in supporting communities and health workers within them to face these consequences of climate change and health, there's likely to be a gap that could be detrimental or very detrimental in the future. How would you like to respond to Elsie Kishoin's concern and then this risk that we perceive from listening and learning with health workers from all over the world?
Thank you, Reda. And that's why I'm so excited about this opportunity here, because hearing the voices, even with the technological difficulties they have to express themselves from the countries where they are and the probably rural areas, it's absolutely very, very much needed to complement the global level influence and the scientific policy recommendations, as you rightly say, empowering communities and the communities having knowledge to be able to go back to these nature-based solutions to make sure that they are better prepared, using sometimes even traditional knowledge that they have and they have not been heard enough. So for me, investing on health communities, on the community and leading and having again the role of the health professionals, the health workers to align the community, to engage, to put together some solutions. It gives me a lot of energy after this discussion today and seeing that, of course, the situation is alarming and is terrible, but I see that at the community level, people is responding already. There are some responses, there are some interventions, and hopefully the role of the health workers will be used to mobilize more those communities and produce results. And through channels like this one, we can elevate it and join forces again. At national level, we will try our best to make sure that the resources are going to support this type of initiatives at the community level, because those are the powerful, empowering, and therefore the ones that can have even more impact, because if you multiply all the communities around the world, your impact and your influence can be absolutely enormous. Thank you.
Thank you very much indeed. Now, we have seen a number of professional organizations of health workers, so doctors' organizations, nurses' organizations, midwives, mobilize their constituencies around this issue of climate change and health. How is that? How do you see that as complementary to what is happening with something like Teach to Reach, where it is individual workers who are responding to a call to action and coming together to share your experience, between that sort of global level representation and people taking individual action? Where do you see the connection and the opportunity to perhaps really connect both individual action and these large global organizations that are advocates and supporters of health workers facing these consequences?
There is no doubt that we need a very high-level global negotiation and influence for those big decisions to be taken. But it's critically important as well that at the community level, who people is already vulnerable, they are already suffering the consequences of climate change. We saw plenty of examples on your exercise, looking at how people is living that. There is no one around who is not on a way or another, on a heat wave or extreme weather event or more diseases, or even the mental health and the panic that this is causing. There is no one that is protected from the effects of climate change. So having the community involvement is the only way to have the biggest possible army around. And this is the only way that we will have a very solid base to implement all the actions we want to have. So the connection can be through the networking mechanism, the associations like yours, groups like yours, foundations like yours, be part of the global networks, and then giving you the opportunity at the COP or at the World Health Assembly to express the voice of those working at the rural level, very peripheral level, because those are the ones that can tell us not only the feedback, but as well of how things are happening at the country level, at the rural level, and what are the solutions we are all together putting in place. I think the voice of the health workers at the front line is fundamental. I think I've been myself one of those for several years, so I know what that means. We need to give you the possibility of having better electricity at the healthcare facilities if we want to communicate. And that electricity should come from solar, not anymore from the diesel engines or something like that. So that's why we want to solarize the healthcare facilities to make sure that everybody will have access to clean sources of energy, electricity, to provide better services to our patients as well at the healthcare facility. But we need to solarize the health system and empower the health workers to be a community agent of change. And I am personally full convinced that this is the energy, the positive human energy that we need to solve such a big public health challenge as climate change is representing for all of us.
Thank you very much indeed, Maria Neira from the World Health Organization, where she leads the climate change and health efforts of WHO. Thank you to those who joined. We have many more questions that we won't get to, so if we leave you thirsting for more, that is a good thing, because that means we hope to see you at Teach to Reach 10. That is on the 20th of June 2024 for Anglophones, and on the 21st of June for those who speak French. We've been really amazed over the last 9 Teach to Reaches. You can see we were at 12,398 at Teach to Reach 6 and 13,676 at Teach to Reach 7. Over 16,000 last October. We were 17,662, and this is an absolutely amazing result. 21,050, and I think the numbers have gone up significantly since then. Health workers connecting not to us, at the Geneva Learning Foundation. That's not the point. The point is the connections you make with each other, learning from each other, supporting each other, sharing experiences. Once again, thank you, and we thank Maria Neira. We have a number of lightning chats coming up. We have 2 more coming up today. The next one is with David Akpan. I'm looking for the right, yes, here. on the question of digital health in relation to climate change and health. So David Akpan is a part of eHealth Africa, and we'll also be hearing from EHA clinics. And then we'll be meeting with Kate O'Brien, Maria's colleague from WHO, on climate change and immunization, looking at that relationship, that link. Kate O'Brien is the director of immunization, vaccines, and biologicals at WHO. So all of that is happening today. You can search for the Geneva Learning Foundation on your favorite social media. And then we'll be, what we're going to do is we're going to do a little bit of a rewind now with all the comments received in today's lightning chat before we close. So here we go. All right, and let's go back here. We're really grateful for your questions and comments and participation, and this is one of the ways in which we honor that participation. Thank you.